All right, thank you for keeping it daybreak this morning. It is the second day of August, the year 2023, and it's a very crucial week as we mark the World Breastfeeding Week that began yesterday. Will run all the way till the 7th of this month. Usually it is a time for us to focus on how far we've gone when it comes to addressing what we call the exclusive breastfeeding and just breastfeeding in general, why it is important and why we are often not really giving it the priority that it deserves. What do we need to do in terms of policy and even the legal frameworks to be able to support parents who are on that particular journey? And we want to talk about exactly that. And I promise you, before we conclude this program, we'll be having a practical session on how to breastfeed. So something to really look forward to. This year's theme, of course, centers around enabling breastfeeding and making a difference for working parents. So how is this going to be possible? That's what we want to discuss this morning. And I have the privilege in studio this morning to be hosting a panel of two ladies who really have depth when it comes to matters, childcare and pediatrics. And with me in studio, I'll start by introducing the lady on my far right. Her name is Mary Madenge. Mary is a lactation manager at Aga Khan Hospital, has been around for over 20 years just doing this. She has spent all these years crying and laughing and enjoying and rejoicing with mothers. And she will be telling us a bit about that, how that experience has been. She's a trained nurse. And of course, we also have in studio this morning with us Dr. Emily Njuguna. She's a pediatrician, and currently she's the Africa Maternal and Newborn Care Advisor for PATH. But she has been trained also on pediatrics and child care. Over 13 years, she has experience in Kenya's public health sector. And I can go on and on about her rich profile. But thank you, Dr. also, for creating time for us this morning. And of course, one interesting thing about you, Dr. is also you are part of the team that birthed what now we have as the very first human milk bank in Eastern Central Africa that is currently based at the Pumwani Maternity Hospital. Yes. And something interesting that has just set us as a country on the forefront in leading this. We'll talk about that in a bit. But thank you so much, both of you. Thank you for creating time. Yes. I wanted to ask you this question, Mary, the moment I heard that I'll be having you on the panel this morning. How many babies have passed through your hands? 20 years is quite a journey.
Actually, after I finished midwifery, I joined Aga Khan Hospital way back in 1992. So actually, the first 22 years I used to work in NICU newborns. After that, now breastfeeding. So my experience is like 31 years.
31.
31 years. So I have seen many babies, thousands. And I can tell you the babies who are born when I joined Aga Khan in 1992, I taught them how to breastfeed. They have come back themselves. They have delivered their own babies, and I have taught them. So I've seen generation and generations. So there are thousands and thousands of babies.
Must be a fulfilling job.
Oh, yes, it is.
Sometimes hard moments, difficult moments, sometimes good moments celebrating with mothers.
Most of the times, especially in breastfeeding, it's mostly joy. Earlier years when I used to work in NICU, maybe there are a few challenges there, so there were moments of tears. Yeah. Yes, but in breastfeeding, basically, it's mostly joy.
Joy.
Yes.
All right, and you bring that joy in studio. As you can see the setup there. Of course, you'll be taking us through the basics in breastfeeding. But, we're talking about exclusive breastfeeding in the first 6 months of the life of a child.
Yes.
Just tell me why this is crucial. I think that's the most basic point to start this conversation on.
It's because the first 1,000 days in a baby's life determines how that person will be in his entire life. So once the baby is started on exclusive breastfeeding, breast milk is a complete meal, full of antibodies, full of everything that the baby requires. It has 70% of water, So even baby does not require
don't need water.
Nothing else apart from breast milk for 6 complete months, or to be precise, for 180 days. Baby has a full meal from the mother. It is protective because of the antibodies. Babies who are exclusively breastfed, they rarely get sick. Very, very rarely. They even don't get complications later like overweight, diabetes, all these things. So for a baby, it is a meal that is complete with all the nutrients and requirements. Also beneficial to the mother. Emotionally, psychologically, physically, it is very fulfilling. It is also known to protect mothers from some diseases like breast cancer, ovarian cancer, uterus cancer, all these cervical cancers. Mothers who have breastfed, the chances of getting those diseases are reduced by 50%. Yeah.
Wow. And when you say exclusive breastfeeding, some people would say it's easier said than done. And you're here to tell us it's easier done than said. Actually, at the end of this, what we want to prove to mothers is that actually exclusive breastfeeding is possible, but that also they need support on how to make that practical. But Dr. coming to you, looking at this particular week, I think also just to paint a picture of where we are at when it comes to fulfilling this very crucial need. Where is Kenya when it comes to actually implementing the exclusive breastfeeding and just making sure that children are able to get this, because it's actually a right, if you may ask me. Where are we?
Absolutely. And I think, let me just start by adding on to what my colleague has said. You know, breast milk is a complete meal. In the first 6 months, it should be able to cater for 100% of a child's nutritional needs. And between 6 and 12 months, it accounts for 50% of all their nutrition needs. And beyond that, up to 2 years, about 1/3 of all their needs. And as a country, we have done fairly well. We are one of the only few countries on the continent that have been able to keep our rates of exclusive breastfeeding above 60%. But I must say that we have done better before. Looking at the Kenya Demographic Health Survey of 2022, our rates of exclusive breastfeeding actually went down to 60%. We were actually higher than that. And again, you know, there's also another parameter that we check looking at breastfeeding, which is the ability of an infant to receive breastfeeding within 1 hour of delivery. That as well has reduced to 60%. So as a country, I think we have done well, yes, but I think we can do better. We have done better before, and we can do better. Additionally, looking at our rates of malnutrition as a country, malnutrition is when you have lack of adequate nutrition, and it leads to certain consequences. And we have certain parameters as healthcare workers that we look at. Looking at chronic malnutrition, which is the malnutrition that occurs over a long period of time, we call that stunting. That our rates of stunting have actually gone up. Okay. They have gone up. They've gone down to 18%, but however, our rates of acute malnutrition, the one that occurs over a few weeks, has increased to 5%. And that's something that we need to think about as a country, because it looks like we are not supporting women as adequately as we should, so that they can be able to exclusively breastfeed their babies. And as we said, if a child misses out on breastfeeding in the first few months of life, then really they lack the nutritional needs that they can get from the milk, including the immune component, which protects them against diseases, and also the ability to survive and thrive and grow well.
Yeah, true. Yeah. And you've talked about the lack of support for breastfeeding mothers, and that's, I think, is one of the issues that this year's theme is actually centered around. And I want you to talk to me a bit about what this theme means for you. Enable breastfeeding, making a difference for working parents. Why working parents? Why are they being prioritized? Where are we coming from with this particular issue?
I think the issue is that, you know, about 800 million women across the world are not able to exclusively breastfeed because most of them go back to work after 3 months. And what ends up happening is that once they get to the workplace, they don't have the adequate provisions to continue breastfeeding their babies. Remember, they have to juggle their career and, you know, trying to breastfeed their baby, but also keeping up their milk supply can be very difficult when you're in a, you know, a very difficult workplace. You don't have the provisions to continue expressing your milk. And that's why this year, you know, the theme is around enabling parents to breastfeed their babies up to 6 months exclusively and beyond to 2 years. And as a country, really, we have many regulations. We have the Constitution of Kenya that talks about, the rights of a child to receive adequate nutrition. We have the Health Act, for example, of 2017, Articles 71 to 73, that talk about, the need for employers to have dedicated lactation spaces for women to breastfeed. A lot of our women are breastfeeding their babies in toilets, expressing their milk in toilets. This act actually states that we should have lactation spaces that have sanitary conditions and adequate provisions for expression of breast milk. But this act also calls out the need for regular breaks for these women throughout their working day. We have other acts, for example, the Employment Act, that calls out the need for, actually, it protects maternity leave up to 3 months for women and paternity leave of up to 2 weeks for men. And also we have the Breast Milk Substitutes Act that sort of regulates how we promote and avail breast milk substitutes, in this case formula, to women, especially in the communities. And we have so many legislations and regulations around trying to protect breastfeeding. However, it's not translating to action.
Why are we not feeling it?
I think the gap
The reason we're having this conversation is because I think failure to implement.
Absolutely.
Yeah.
And I think the onus is on all of us. We have policymakers, we have lawmakers. Just last week we were lobbying with the lawmakers to really help us to enforce some of these acts, because we have beautiful documents that are spelling out how we should support women to breastfeed, but it's not translating to action. And so what we were calling out with the lawmakers and parliamentarians is that we actually need to enforce these things and call to organizations to account when they do not have some of these provisions that are called out in the law. For example, lactation spaces are actually called out in the Health Act. So why is it that most organizations do not have these provisions? And I must also mention that beyond formal employment, we also have very, very many women in this country who are under the informal sector, working in coffee farms and other informal places. A large study done by UNICEF really looked at how they could support women in one of the tea farms in Kericho. They did a lot of advocacy with the managers, trying to get them to give paid leave, breaks for the women. They provided lactation spaces, even childcare for these women. And that study was fantastic. They showed that the rates of exclusive breastfeeding for the women in that particular tea plantation went up from 20% to 80%. Meaning that even in the informal sector, we can actually support women to breastfeed. And that's where the gap is greatest.
Yeah. Mary, when we're talking about support for lactating mothers at the workplace, what's the nature of this support? How does it look like from your point of view? If you take us into the mind of a lactating mother in a working environment, when we want to support her, what is it that we are exactly talking about in practical sense?
Yes, as the doctor has said, first of all, it is in the policy that every employer must provide that room. So every institution should have a room dedicated for lactation mothers, and that room should be used for mothers to be able to express their milk, or babies can be brought to them to breastfeed, then they go back home, or they can be given time now even to go home to take that milk. But now practically, like where I work in Aga Khan, we have a dedicated room which has a fridge, it has lockers where a mother can express her milk, label it and put it in the fridge, and her breast pump and all that, she can lock it in a locker. But now, time factor, that is what also the employer should be able to do. For me personally, I advise people who are working for milk supply to continue, because if when they're on maternity leave, the baby is breastfeeding on demand when they want, and every 3 to 4 hours. When they go back to work, it should be like they're having the baby with them. If the baby is at home, they have to express. It has to be every 3 to 4 hours. So the employer should be able to permit that mother to express, for example, at 9 o'clock, 1 o'clock, and 3 o'clock. At least that.
They need breaks.
Yes.
Right.
At those those intervals.
Yes.
Okay.
Then from 3 p.m., maybe they don't need to express again, so that by the time they are reaching home, the breasts are full, then they continue breastfeeding throughout the night. Then the milk they have expressed at work, they go and freeze it, so that when they are at work, the baby is still getting their breast milk. Yeah.
Okay. So I wanted to understand the difference in terms of even what should that lactation station have to consider concerns such as hygiene, to consider concerns such as the quality, for lack of a better term, of the milk. What are the basics that, in case an employer is watching today and they want to go that direction, a standard lactation station?
So a standard lactation room, first of all, should have comfortable seats where the mother will sit comfortably, because they need to protect their backs and all that. It has to have some tables. Then a fridge, so that when they express their milk, okay, before they express, we need to have a sink with running water. If not that, they can have the hand sanitizer, the gels, so that they can clean their hands. There should be a fridge where this milk will be stored, where they are still at work. Preferably, they should also have something to drink. There should be drinking water, because when the mother is expressing her milk, she's getting dehydrated. And for that milk to sustain, she has to be well hydrated. So there should be at least a dispenser of water for them to take. Preferably, they should also be given something hot to drink, so they can put some, maybe drinking chocolate there, some Milo, free, not chargeable, free, so that they can encourage. I've visited like 2, not in my institution. In my institution, they are provided with all that, but the institutions I've seen one, like the one she talked of, a tea farm. This is not a tea farm, but it's similar, and they have done a fantastic breastfeeding rooms for those workers. And since most of them, they don't have fridges at home, they have invested a big freezer for them. So they express and they freeze the milk at the place of work. So when they are going, they only get what the baby will be taking. Yeah, so that is what they need. Basically, that's what they should have. Comfort, yeah.
And Mary, just to ask you, because I've had this question over time also, in case a woman does not have the luxury to own like a freezer or a fridge, then does that mean that they cannot, store the milk and preserve its quality? Or how can it be done under those circumstances where you cannot be able to have a fridge or a freezer?
If you can't have a fridge or a freezer, what we advise, if milk is expressed and is not even put in the fridge, it is good up to 8 hours in room temperature. What they can do, before they leave for work, they can express milk that the baby can take within those 8 hours, and that milk is still safe. Maybe where they are working, they can still express at work, and if there's an arrangement of how that milk can be sent home by somebody, then by the time the baby has taken that, the mother is also now going home, then she can continue breastfeeding. Yeah.
All right. So you said that the milk can stay under room temperature for 8 hours and it will still be okay?
Yes.
All right. What about the portions of storage? Because that is also another issue. You can find a woman who has expressed maybe 1 liter and then they keep that 1 liter like in whole, like that. Is that recommended?
No, it's not recommended, because milk, if baby has to be given that milk, it has to be warmed to the room temperature. First of all, breast milk can't be boiled. It can't not even be put in the microwave. It's just a warm bath in warm water. So once it has been put in that warm water, It cannot even be put back to the fridge, and it is only safe only for 4 hours. After 4 hours, we can't use it. Now we discard, and we don't encourage rewarming, because that is a way of now can introduce bacteria and all that. So we advise an amount that the baby will be able to finish. And again, it depends at what age. Because let's say a baby who is about 4 months or so can take even about 100 to 150 ml at one go, and they finish. So milk should be kept around that, between 100, 150, and maximum to 180, so that even if the baby does not finish, then the wastage will not be a lot.
Okay.
Yeah.
I'll come back to you on the practical now to show us like the best, because they say, oh, breastfeeding is a natural process,
right.
But it's not as natural. It is actually something that should be done right.
It is true. It is not automatic. It's a skill that,
right.
yes.
Yeah. You'll show us in just a bit. But Daktari, coming to you, you know,
yes.
You've cited quite a number of laws that protect the rights of a mother, a lactating mother.
Yeah.
But also the concern about the snail-paced approach to the implementation of some of these laws. But I'm asking this morning, in case there are women who could be in a workplace where this is not being done, do they have like a point of recourse? Like, what options do they have? What can they do, or what is currently being done to ensure that as many workplaces as possible are compliant?
Yeah.
Because we have very few actually countable.
Yeah.
I'm lucky my working station is among those that are compliant.
Yeah.
That's good.
Yeah, so women actually have quite a number of avenues for recourse in this situation. And usually the starting place is talking to your line manager and just saying, you know, these are the provisions of the law, or for example, the human resource manager, and just saying, you know, these are the provisions of the law, I am breastfeeding, I need this support, can you help me? And in most cases, most employers are amiable and they're able to, you know, give these provisions once, you know, health workers have brought it up to them. But really, it should not wait for healthcare workers to bring it up for employers to take action. But beyond that, we have other avenues that, you know, women can utilize. One is the unions that where they are registered. For example, under the doctors, we have the Kenya Medical Practitioners and Dentists Union. Such unions and such bodies help to lobby employers to be able to enact some of these provisions to protect breastfeeding. And we also have the Federation of Kenya Employers, who we are really lobbying right now to be able to get all their members to comply with the law when it comes to breastfeeding protections. And so there are so many other avenues upon which women can actually get protection and support for breastfeeding.
Okay.
Yeah.
So it's not, all hope is not lost.
Yeah, absolutely.
Absolutely. Right? Because it's a right, actually, not just for the mother, but also for the baby.
Absolutely.
And the entire society. Because if you think breastfeeding is difficult and expensive, try not breastfeeding.
Yeah.
The repercussions that come with it, the diseases, the amount of money that you're going to be spending to treat the diseases that come with it for both the mother and the child.
Yeah, and if I could add to what you're talking about.
Yeah.
So Kenya is currently, you know, a study done in 2014 showed that Kenya is losing about 376 billion Kenya shillings from malnutrition and just not supporting children under 5 to breastfeed well and to get other forms of nutrition. And of these, about 18 billion goes to healthcare expenditure, you know, treating malnutrition, pneumonia, diarrhea, and all these other diseases. And a small proportion goes to other expenditure. But the biggest expenditure that we have as a country is from loss of productivity. You know, some of these children end up, you know, with lower IQs, so they score lower in school. They end up repeating some of the lessons that they have to do in classes, and so they tend to lag behind. And so, as a country, we are losing more than 300 billion from just loss of productivity because of undernutrition. And so, you know, we have rights enshrined within the Constitution that we need to protect these children. And what really we're lobbying for is that everyone needs to wake up and realize that this is not something that we are recommending. It is a right for all children to get adequate nutrition and for mothers as well to be protected to breastfeed.
That is almost, 300 billion is almost half
Yes.
the current allocation for the education sector in the current budget.
Absolutely. So
that's how much, you know, we are losing because we are not, you know, having our priorities right.
Yes.
But anyway, we'll talk more about that. But Mary, let me just give you a chance because people want to know the practical side of it. It's not as easy as you know people think it is, or as natural as. So how do you breastfeed the right way? What are some of the basics? And you can show us also.
Okay. So first of all, as she had said earlier, the WHO recommends any baby delivered must be put on the breast within the first 30 minutes if it's a normal delivery. If it's a cesarean, at the earliest opportunity when the mother comes from theater. And breastfeeding is not automatic. Baby knows. When the baby comes out, they already know how to suck, but most of the time the mothers don't know. So what is very important, how the baby is latched on the breast, because if the latching is long, the nipples will crack, then the mother will not be able to breastfeed. The positioning, how the mother is, because remember, mother has lost a lot of calcium during pregnancy. The bones are not strong, so she should protect her back. The baby also should be in a comfortable position. So mother and baby should always be in a comfortable position.
Comfort is key.
Yes. So maybe let me start with the breast, because that's where the milk comes from. So it doesn't matter whether it's a big or a small breast. What is inside the breast are the cells that make milk. Then that milk flows through some ducts that open into this dark part. Okay. We call it the areola. So milk storage is here. The nipple is actually just an outlet. So when the baby is latching, the baby should not latch on the nipple, because if you give the nipple, they bite you with the gum.
You could just, so that,
Yeah, so if baby is given the nipple, which is an outlet, they bite it with the gum. So the baby should come where the milk is. This is the areola, suck, bring the milk out. So that's one way of preventing cracked nipples. So proper latch is important. So the midwife with the mother must teach that mother how to latch the baby the right place beyond the nipple. And then at that point, she should also be taught, when she has finished breastfeeding, she doesn't pull the breast away from the baby because the baby bites. So it's putting a finger on the side of the baby's mouth and pulling, then the baby opens. After that, the mother is advised to squeeze a little bit of her milk and apply around the nipple area. Breast milk has antibodies, which now acts like a natural antibiotic, protects the dryness and the further cracking. So proper latch is very key. Then when it comes now to the, and also maybe at that point, how to hold that nipple. You should, because I've said milk is here in the dark part, the mother should avoid holding the breast like this, because this is called scissoring. So you are trying to block the milk, and the baby is sucking. So baby is literally getting nothing.
What I think they're doing is to help the milk to come out faster.
Yes. Yet that is now restricting. So what we are advising is what we call a letter C method. You lift the breast up like this, then the thumb like this. You see, you form a letter C, then the baby goes there. They suck at their own, yeah. Okay. So that is now about the latch and holding the breast. When now the baby is coming to the breast, how you hold the baby is also very, very key. There are three main positions that we advise, and it's important for a mother to know different positions, because especially the first month, baby should breastfeed on demand and not sleep more than 3 hours. That means in 24 hours, the mother should be feeding that baby minimum 8 times.
8 times.
It can be more if the baby has woken up before 3 hours. So if a mother is waking up every 3 hours to sit, her back will give way. So it's important to learn different positions. So the common one is what we call the cradle, where the baby's tummy and mother's tummy face each other like this. Then this underarm should always be under the breast. Then the baby now comes here, and then she just feeds.
Okay.
So that is called cradle.
Cradle.
Yes. There's also another one, we call it the football or the rugby, where the mother now holds the baby from the side, tucks the baby there, supports the baby, and she gives the breast. This is especially good for a mother who has had a cesarean section, because now they will not be putting the baby on the tummy. Yeah. In case the mother has twins, it's also a very good position where now she can hold both of her babies like this.
So they can breastfeed at the same time?
At the same time.
Wow.
Yes. So it's very, very possible. The other position is where now the mother and baby can lie down. It's called the lying down position. So they face each other. It's like tummy to tummy, but they are lying down. And then the mother just gives the baby the breast, making sure the nose is not blocked. Then after that now, she can sit and pap the baby.
Okay.
But now these days we have this, they are called the nursing pillows. The purpose of this nursing pillow is to prevent this mother going to the baby, because her back will be. So when you hold the baby like this, you see the elbows and the weight of the baby is on that pillow like this. So that mother can breastfeed even for an hour very comfortably. Then when the baby is sucking, they try to suck in a bit of air, and that air, when it goes to the stomach, is gas, and it's very painful. So it's advisable, once the baby has finished on one breast, the mother should hold the baby like this to try and remove that gas, circular, and baby can either burp, sometimes they just fart it out, or they can just poo. 2 to 5 minutes, that gas should be out.
Okay.
And now, when we come to the breast, maybe to go back a bit, the breast has 2 types of milk all the time. There's formilk, there's hide milk. When the baby sucks the first 10 minutes, the milk that comes out is very watery. And breast milk, 70% is water. Nutrients is about 30%. And that's why babies don't need water at all. So when baby has sucked only 10 minutes, that baby has not gotten the nutrients. So it's basically water the first 10 minutes. Beyond the 10 minutes, we go to the hide milk, which has fats for energy, calories to satisfy hunger, to maintain good sugars and for weight gain, and also proteins. Okay. So when the baby is on breast, must empty one breast completely to have a complete meal.
All right.
Yeah.
Wow, that is well explained. And you actually thought it's easy. It's not. So it's a skill that you actually need to learn. It is true. You do it, but you learn to do it properly.
Absolutely.
Yes.
Okay. So, Dr. there are certain instances where baby cannot be able to exclusively breastfeed.
Right.
What are those circumstances that under which a child is not able to rely on milk alone, and what are some of the recommended options, and how do we guide that space as well?
Yeah, okay, thank you. I think that's a very good question because it's a reality. A lot of mothers, are unwell, babies are unwell. If you look at, for example, babies who are born before time, we call them preterms, they tend to have certain challenges with being put on the breast. Some of their reflexes, as she mentioned, the sucking reflex is not well developed when they're born early. And so these children tend to rely on mom expressing their milk and giving it to them, okay? Now, in a situation where mom is not available, she's unwell, for example, she has had complications following delivery, she has gone to ICU for one reason or another, WHO actually recommends the second best option when mother's own milk is not available is something we call donor human milk. So that means milk given by another mother. The same way we donate blood for other patients in hospitals, we can also donate donor human milk. And just to some of the points that you mentioned earlier, we as a country set up the first human milk bank in 2019, and I was part of the team that was in Pumwani at that point. And this particular facility, what it does is that it receives milk from donors within Pumwani Maternity Hospital. It screens the donors, making sure that they don't have any transmissible diseases, HIV, hepatitis. It pasteurizes this donor human milk, ensuring that all the bacteria and other contaminants are removed from this milk, and then it dispenses the milk to the babies who need it. And that's done through a centralized place where there's, many checks and balances. Safety is top priority for that human milk bank. And so that's how we're able to provide donor human milk. Especially for small and sick newborns. And that's because a lot of them also cannot digest formula. And, a lot of them, science has shown that when they're given formula, they actually get very severe, very debilitating infections of their gut, something we call necrotizing enterocolitis, which can actually be fatal. And so, WHO last year came out very strongly in one of the recommendations for care of preterm and small and sick newborns and low birth weight babies, saying that, if you do not have mother's own milk, the second best option is actually donor human milk. And so what we are doing right now is to really lobby for that
so
to
it's
be
still
expanded.
Internal at Pumwani.
Yes.
Was that it, or what are the plans?
So the Human Milk Bank within Pumwani was actually the country's pilot. Okay. And so, the Ministry of Health, and we are very grateful for their support, they're really looking to scale up this intervention across the country to all counties. And we are hoping that we can set up Nairobi as a center of excellence. Just to call out that we have had several countries reaching out to Kenya asking for assistance because they also want to set up these human milk banks. We have had talks with Tanzania, Uganda, Ethiopia, Zambia, Zimbabwe, and the list is endless. Yeah. And just to say that this is an intervention that has been deemed safe by WHO. There are several checks and balances to ensure that there's no transmission of milk. And so there are really no concerns that we can talk about.
Mary, is there any such thing as a woman not being able to produce enough milk for the baby? Because that's also another issue. I mean, is it? Yeah.
Okay, what I would say, basically, with all my experience of over that 1 year, I have never seen a woman who was not able to produce milk, even if it's little. The only difference is we are not all the same. There are women who leak milk when they are pregnant. Some women are even expressing milk when they are still pregnant to keep it. Others, until the baby comes and maybe sucks for about a day or even 2 days, is when the letdown will be. But all what I know is no woman does not have enough for her baby. And nature is so beautiful. Before the baby is born, they don't pass poo in the inside. They only pee. So the stomach of the baby is so small. So when the baby is born and the mother puts, even if he has produced just 1 drop, that is what the baby requires for that day.
That time.
They don't need much. And the more the mother breastfeeds, the more milk. And I always say 3 B's must work together. Baby sucks on the breast, so that's our 2 B's. Message is sent to the mother's brain. The brain produces 2 hormones, prolactin and oxytocin. Those hormones go to the mother's breast. Prolactin stimulates the cells. Oxytocin makes the breast to contract to release the milk. So the more the baby is sucking, the more the message, the more the hormones, the more milk the mother is getting. So it's a natural process, but oxytocin in normal life is a happy hormone. It's a feel-good hormone. It's called love hormone. It has to remain happy. If the mother gets stress, she's not getting support, or she thinks she doesn't have enough, she stresses the oxytocin, so the letdown is down. So what we advise mothers, just let go, be easy. I tell them, easy does it. Don't stress. Just relax and wait for nature to take its course. Yeah.
What can be done to encourage more milk production for a mother?
Okay, so first of all, no stress.
Yeah.
Be easy. Then put the baby on the breast on demand and every 3 hours, especially the first month. Then the mother must rest. For oxytocin to remain happy, she must also sleep. In the first 1 month, babies only do 3 things: pee, poo, eat, sleep. And they don't have a day or night. It's normally a 24-hour cycle. So the mother must adjust to that cycle. When baby sleeps, he takes a little nap. Otherwise, by the end of the day, if she's working too much, thinking at night she'll have time, the baby does not know there is a night. So mother must, and that's why they are given the 90 days. And within those 90 days, they need a lot of support. That's where the partners and the family should be doing all the other house chores as mother concentrates with her baby so that they sleep together.
Yeah.
So those are two. Then the other thing is what the mother is taking. For me, I tell them, drink for 4, eat for 1. So in other words, take a lot of fruits. It can be water, it can be whatever they are able to take, but a normal balanced diet. It doesn't have to be expensive, what they are able to get.
To afford. So this thing of eating for 2, drink for 4, eat for 1.
Yes.
As we wind up this discussion, Daktari, this week is very crucial. What are some of the fundamental issues that we should focus on as we gear towards 7th, which will be the climax of this celebration?
Yeah, I think we are very happy across the healthcare sector because we are finally calling out the workplace. It has been a place where, we've not had women getting adequate support. And so we are really supporting them all the way from before delivery, we call it the antenatal phase, during the delivery, and even when they go home. However, the gap remains in the workplace. So mom breastfeeds so well in the first 3 months of life, but after that, what happens? And so this week is really an important week for us as lobbyists, as healthcare workers, and even for parliamentarians, because what we are saying is that we're trying to get all hands on deck so that we can really advocate for adequate provisions for women. We are calling out the need for lactation spaces within workplaces, whether it is formal employment or informal employment. And we're also calling out the need for breaks. We are calling out the need for paid, protected time away for maternity leave and paternity leave. And we're also calling out for support for these women, especially in the workplace.
Okay, thank you, Daktari. Mary, your final remarks. And the passion is evident. Bado umebeba huyo mtoto.
Oh, yes. My other name is baby inside me. Yeah. I love babies. Actually, as the doctor has said, that support at workplace is so important. They need it, and especially the breaks. I know there's a lot of work, and most of the mothers, because they say there's no time. It doesn't have to be an hour of expressing, just like 30 minutes. And nowadays, currently there are breast pumps that has come. They are hands off. You just charge the pump, you put it on your breast, you wear your bra, and you continue with your work. Nobody knows what is happening. You can do everything. So things are getting easier and easier, but these mothers need a lot of support. Support is key. And one thing, because I've met so many, most of the private institutions, they are doing very well with giving mothers 6 months maternity leave. Others, the lactation rooms are there, breaks. But our government, the most mothers I talk to from the government, they don't have spaces for breastfeeding, so the government needs to really do a lot of support.
Thank you, Mary.
Yeah.
Unfortunately, we've run out of time for this very important conversation. Of course, we just touched a few pertinent issues. It's a conversation that is deep and needs further discussion. I was having a sit down with Dr. Emily Njuguna, a pediatrician, and also currently serves as the Africa Maternal and Newborn Care Advisor for PATH. And also with me in studio this morning, I was having Mary Madhenge, a lactation manager at Aga Khan Hospital. Thank you, ladies, for creating time this morning.
Thank you for having us.
All right.
Thank you.
As we mark the World Breastfeeding Week, the theme this year is to enable breastfeeding and to make a difference by supporting parents. That's mother, father. So men also have a role to play in this particular journey. When you get that 2 weeks paternity leave, it's not your time to go enjoy yourself. It's your time to support your partner and make this journey worthwhile. My name is Safina Cheng Oma, and that's how we wrap it up. Thank you for watching Daybreak this morning. Have a good day.